Assalamu alaikum. This is lecture number 6 for the second semester of medical parasitology. At the end of this lecture, you will able to define the phylum Apicomplexan, describe the Apicomplexan structure that's used by this phylum for movement, describe the phylum Apicomplexan class Sporozoa genus Plasmodium, the causative agent of disease malaria, list and describe the species of the genus Plasmodium, list and describe the disease caused this gene. Also, we will describe the clinical manifestation of disease malaria that's caused by the genus Plasmodium, their complication, we will describe their diagnostic methods, also describe the treatment and control measure, and finally we will define and describe the disease babesiosis, that's malaria-like disease. We all remember from the first lecture, we divided the subkingdom Protozoa to Sarcomastigophora, which contain amoebae and flagellate, like Giardia. The second phylum Celiophora, which contain Balantidium coli, and the phylum Apicomplexan contain Coccidia, like Cryptosporidium, Isospora, and Toxoplasma, and class Sporozoa, which contain Plasmodium and Papasia. Apicomplexan, it is contain apical complex. We call it apicoplast, used in certain stages for movement. It is unicellular spore-forming organism, exclusively parasites. There is no free living organism in this phylum. It is contain complex life cycle, contains sexual reproduction by sporogony and gametogony, and asexual reproduction by schizogony or merogony. This is picture for electron microscope, represents the Apicomplexan structure that used for movement, gliding movement. It's contain apicoplast, microneme, conoid, and other structure. Before discovered electron microscope, the scientists believed that they not contain movement organelles. But after discover the electron microscope, they see it, the Apicomplexan structure that used for movement in this phylum. This is the general life cycle for Apicomplexan phylum. It is very complex life cycle. It's contain sexual and asexual life cycle. Asexual by schizogony or merogony produce merozoites. Some of them will produce gametocytes, macro and microgamete by gametogony. These will unite and produce zygote, which reproduce by sporogony and produce sporozoites. The first disease caused by the phylum Apicomplexan, it is malaria. Malaria has been and is still the cause of much human morbidity and mortality. Malaria is caused by members of the genus Plasmodium. Plasmodium species belong to the Apicomplexan phylum and class Sporozoa. Their life cycle involves two hosts, a vertebrate host and arthropod vector invertebrate host, restricted to Anopheline mosquito. Vertebrate hosts include reptiles, bird, rodent, monkey, and humans. But only 4 species are in fact a human, which is Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Plasmodium species are host specific and there are no zoonoses. This disease, it is discovered by a physician soldier in French army, Alphonse Laveran, which served in Algeria, first discovered in RBCs, and he said that it is belonged to the Protista in 1880. Till this Chewett in 1980 has represent information on the malaria parasites, their vector, the disease epidemiology and control measure. نلاحظ من هذه إنه استغرقت 100 years لاكتشاف كل المعلومات اللي تتعلق بالملاريا، رغم إنه هي معروفة from the ancient time. Malaria, 40% of the world population lives in the endemic areas. There are 300 to 500 million clinical cases per year, 1.5 to 2.7 million deaths occur per year, 90% in Africa, with majority of death in young children. Plasmodium vivax species more prevalent because it is more tolerate the lower temperatures. كل species يسبب disease إلى تسمية خاصة للملاريا. So we have Plasmodium falciparum cause malignant tertian malaria. It is the most severe type of malaria. It is 2-day cycle. Also, we call it falciparum malaria. While Plasmodium vivax cause benign tertian, also 2-day cycle, or we call it vivax malaria. Plasmodium ovale cause oval tertian malaria, 2-day cycle, or oval malaria. Plasmodium malariae cause quartan malaria, 3-day cycle. The life cycle include asexual phase, occur in human vertebrate host, alternating with the sexual phase which contain mirogony and sporogony. Mirogony started in human and complete in mosquito, while sporogony in mosquito invertebrate. This picture indicating the life cycle of Plasmodium as a species. It is a very complicated life cycle. We have human stages and mosquito stages. In human, we have liver stages. We call it exoerythrocytic cycle, and peripheral blood stages. We call it erythrocytic cycle. We will start with the infective stage from mosquito. Salivary gland of mosquito will bite the human, and the infective stage, it is sporozoite. The mode of transmission, insect bite. This sporozoite with half an hour will disappear from the peripheral blood, go to the liver. It contains ligand special for the hepatocytes and enter the liver cell, hepatocytes, then reproduced by schizogony. Each sporozoite will produce thousands of schizons or merozoites. This will lead to a rupture of the hepatocytes. This cycle, we call it exoerythrocytic cycle or a pre-erythrocytic cycle. It is not repeated. لذلك نلاحظ أن السايكل تبقى مفتوحة لأن هذه ما راح تتكرر. The merozoites will enter the peripheral blood, enter the RBCs, will develop to immature trophozoite. We call it ring stage because contain a large central vacuole, the cytoplasm and the nucleus in the peripheral side. Then develop to mature trophozoite, or we call it amoeboid stage. This will reproduce by schizogony and produce certain numbers of merozoites, lead to rupture of RBCs, and the cycle will repeat it. So لذلك نلاحظ أن السايكل تبقى مستمرة. This cycle we call it erythrocytic cycle. In for unknown reason, some of merozoites will develop to gametocytes. This gametocytes is effective to the mosquito. When the mosquito will take blood meal from the affected person, take the macro and macro gametocytes. This will go to the gut of the mosquito and develop to macro and micro gametes, unite and produce zygote. This zygote will move from the gut to the epithelial cell, lining epithelial cell of the gut and develop to ookinase البيضة المتحركة. This ookinase will develop to oocyst. Oocyst will produce sporozoites which migrate to the proboscis of the mosquito or head of the mosquito to the salivary gland, and the cycle will repeat it. So we have two transfer stages, sporozoites from mosquito to man. It is infective stage to man. And we have gametocytes from man to mosquito. It is infective stage for mosquito. So as we see, it is very complicated life cycle. We have invasive stages. We have first merozoites invade erythrocytes. Sporozoites invade salivary gland of the mosquito and hepatocyte of human. Ookinase will invade epithelial cell of the gut of mosquito. This two picture first for the anopheles female, as we say, it is the pregnant female need blood to nourish and develop their eggs. So the pregnant female anopheles, it is transmitted the disease. And the other picture for the sporozoid, the effective stage, for the disease to the human, it is spindle shape, very delicate form. Malaria transmitted, we have many methods for transmission. The main method, it is naturally by insect bite. As we say, the pregnant female anopheles will transmit sporozoites. Also, blood transfusion from the infected person will transmit the disease. It is characterized by shorter incubation period, very fatal disease, especially that caused by Plasmodium falciparum, and no relapse possible because we have no hepatocyte stage. مباشرة يذهب إلى الأرثروسيتيك cycle. Relapse we will define later, caused by Plasmodium vivax and the Plasmodium ovale. The other method for transmission is syringe sharing, especially between the drug users. Also, we have congenital transmission. It is very rare. Occur in placenta when contain heavy infection by Plasmodium. As we say in the life cycle, we have exoarthrocytic cycle occur in the liver, in hepatocytes. The incubation period differ from species to another. The pre-patent period, the longest period occur in malaria. Also, the incubation period occur in malaria. The shorter period occur in Plasmodium falciparum. للتذكير, incubation period, it is the time between the inoculation of parasites to the first appearance of clinical manifestation. هذه الفترات مو للحفظ بس حتى نعرف إنه منو الأقصر فترة يا سبيشيز أقصر فترة ويا سبيشيز أعلى فترة. We have hypnozoid form. راح نلاحظ إنه في بعض certain species وخصوصاً Plasmodium vivax و Plasmodium ovale. We have in exoarthrocytic cycle some sporozoids exhibit delayed replication as in dormant. تبقى ساكنة ما تكمل اللايف cycle لكن after months or years it will produce merozoites. So we call it hypnozoites. We have here the renewal clinical manifestation without a new infection because of presence of hypnosis. These manifestations occur only in Plasmodium vivax and Plasmodium ovale. It does not occur in Falciparum and Malarial. We have term malaria pigment or hemoglobin pigment. Here, this pigment produced when the parasites feed on the hemoglobin because it's life in the erythrocyte. It does not completely metabolize the hemoglobin and leave behind a hemoglobin pigment called malaria pigment or hemozoin residue. The malaria pigment released when the parasitized cells rupture and will phagocytized by reticular endothelial cells. Such pigment-laden cells in the internal organs provide histological evidence of the previous malaria infection. إذن هي indicator لنوع الباراسايت اللي مصاب وأيضا indicator للإصابة القديمة للملاريا إذا ظهرت بالتشو. This picture indicating the erythrocytic invasion in erythrocytic cycle. It is like key and their lock. The cells of parasites will reorientation and differentiation, then junction formation, and will touch to the special site in the RBCs and entry. To differentiate between species, we minor use the life cycle variation by presence of hypnozoite stage in vivax and ovale. We have sequestration in falciparum, sequestration الاختباء. مو كل الستيجز بالفالسيبارم تظهر بالارثروسيتيك cycle in peripheral blood, only ring stage and gametocytes. The other erythrocytic cycle will sequestration in the internal organs. This is used for differentiate between species. Also, the type of erythrocytes preferred by the parasites used for differentiate between species. Vivax and ovale prefer immature erythrocyte, while malaria will infect the old RBCs or senescent الكبيرة بالعمر أو الشيخة, while the falciparum prefer no type. In other words, will infect all age of RBCs, and this will increase the severity and fertility of the Plasmodium falciparum. Also, we can use disease and the clinical manifestation to differentiate between species. Blood stage morphology also used for differentiate between species. This table differentiate or comparison characteristic Plasmodium that cause species that cause malaria in human. طبعا هنا راح تلاحظون ممكن احنا قلنا هالاشياء راح نسوي differentiation between the age of erythrocytes preferred by the parasite, stages found in the peripheral blood, shape of ring stage, the early trophozoite, also the late trophozoite, we can differentiate between them, number of schizones present, the shape of micro and macrogametes, the duration of schizogony. This is all we use to differentiate between species. This picture differentiates between morphology of the peripheral blood erythrocytic cycle. For ring stage or early trophozoite, late trophozoite or amoeboid stage, shy zone, number of segmenta, and shape of gametes. As we see in this picture, the segmenta we have rosette shape in malaria. It is very characteristic features for Plasmodium, while the trophozoite or amoeboid stage, it is band form for malaria. Gametocytes all are ovoid or ring stage, ovoid or circle in shape, while in falciparum it is falciform shape. تشوفون هذا المربع اللي دا يحوي التروفوزوid shy zone. This table differentiates between mosquito-borne malaria and blood transfusion malaria. As we say, we have many types of transmission. The main way of transmission it is by mosquito bite, while maybe the malaria transformed by blood transfusion from infected person to uninfected. The infective stage in mosquito bite sporozoites, while in the blood transfusion it is trophozoites. It is have long incubation period in mosquito, while in blood transfusion short. Pre-erythrocytic cycle present in mosquito-borne, while it is absent. It is starting with erythrocytic cycle. We have no pre-erythrocytic cycle or exoerythrocytic cycle. Hypnozoite that present in vivax and ovale, it is absent in blood transfusion because it is liver stages. We have no liver stages. The severity, it is very complicated in blood transfusion because it has less incubation period. Relapse not occur in blood transfusion. Radical treatment for treatment hypnozoites not required for blood transfusion, but it is required for mosquito bite. We have two important terms, recrudescence and relapse malaria. Both of them mean renewal of clinical manifestation of the disease malaria without a new infection, but for different reasons. For recrudescence malaria, it's occur in Plasmodium falciparum and Plasmodium malariae infection after a primary attack. Sometimes there is a period of latency during which there is no clinical illness, but some parasites persist in some erythrocytes in level of parasitemia is low, is below fever threshold or sometimes below the microscopic threshold. Erythrocytic schizogony continuous in the body at low levels and gradually the number of parasites build up to cross the fever threshold. Fresh malaria attack then develop. This new malaria attack that appear after a period of latency, usually within 8 weeks after primary attack and resulting from persistence of erythrocytic cycle of the parasites are called recrudescence. Recrudescence may be due to waning immunity of the host or possibly due to antigenic variation. ملخص هذا الكلام إنه في السبيشيز Plasmodium falciparum and Plasmodium malariae في الإرثروسيتيك cycle in the peripheral blood there is low level of parasites غير قابل لإنتاج clinical manifestation or cannot be detected by microscope. راح يبقى يتكاثر بصورة خاملة إلى أن يوصل إلى العدد اللي يفرز به clinical manifestation. هذا دليل على إنه waning of the immunity. هنا الاميونيتي ما اشتغلت زين أو إنه الباراسايت عنده antigenic variation. نرجع لمحاضرة التريبانوسوما حتى نعرف شنو antigenic variation. So, in Plasmodium falciparum infection, recrudescence is seen for 1 to 2 years, while in Plasmodium malariae infection, they may be last for long periods, even up to 50 years. لذلك هنا من الضروري التأكد من علاج حتى بدون ظهور الأعراض، حتى نتلافى الريكرودسنس بيريود أو recrudescence malaria. The other terms, relapse malaria, it's seen in Plasmodium vivax and Plasmodium ovale infection. In both of these species, two kinds of sporozoites are seen, some of which multiply inside the hepatocytes to form schizoids, and other remain dormant. We call it hypnozoites. These later forms are called hypnozoites. Hypno means sleep. Hypnozoites remain inside the hepatocytes as a uninucleated form, 4 to 5 micron in diameter for long periods. Reactivation of hypnozoites leads to initiate of a fresh erythrocytic cycle and a new attack of malaria fever. Such a new attack of malaria caused by dormant exoerythrocytic form, reactivated usually from 24 weeks to 5 years after a primary attack, and we call it relapses. So we have radical treatment for these relapse malaria to kill the hypnozoid redormant forms. As we see, recrudescence and relapse, it is renewal of infection without a new infection to different reasons. This table differentiate between recrudescence malaria and relapse malaria. طبعا احنا كلها عددناها مقدمة بالتعريف مالت المصطلحين. فالمسبب إلها أو إنه وين نشوف إحنا الريكرودسنس نشوفها ببلازموديوم فالسيبارم and Plasmodium malaria, while relapse occur in Plasmodium vivax and Plasmodium ovale. Also, this table indicating the causes of presence of this manifestation represent also time of occurrence of this clinical manifestation, how we can treat it. A clinical manifestation of malaria, it is almost exclusively due to asexual erythrocytic cycle. Tissue schizoids and gametocytes cause little or no pathology. Plasmodium infection causes an acute febrile illness, which is most notable for its periodic fever, paroxysm, occurring at either 48 or 72 hours intervals. الملاريا الكلينيكال مانيفستيشن هي بالبريوديسيتي فيفر، نسميها ملاريا باروكسيزم. راح نتعرف على الستيجز مالت الملاريا باروكسيزم. برودرومال سيمبتومز، طبعا هذه الفترة تبدي قبل الفترة الرئيسية اللي نسميها ملاريا باروكسيزم or febrile attack. It is characterized by end of incubation period, 2 to 3 days before first paroxysm, include malaise, fatigue, headache, muscle pain, nausea, anorexia. In other words, flu-like symptoms. Can range from none to mild to severe, according to the number of parasites and species. Febrile attack or malaria paroxysm, the main clinical manifestation, it is periodic febrile episode alternating with symptoms-free periods. Initially, fever may be irregular before developing periodicity. May be accompanied by splenomegaly, hepatomegaly, slightly jaundice, and anemia. The malaria paroxysm, we have 3 stages of malaria paroxysm. First stage, it is cold stage, characterized by feeling of intensive cold, vigorous shivering, rigor, lasts in 15 to 60 minutes. Second stage of paroxysm, hot stage, characterized by intense heat, dry burning skin, throbbing headache, lasts in 2 to 6 hours. The third stage, sweating stage, profuse sweating, declining temperature, exhausted, weak, then the patient sleep, lasts in 2 to 4 hours. Malaria paroxysm associated with a synchrony of merozoite release تتزامن مع خروج الميروزويت من ال RBCs, infected RBCs. Between paroxysm, temperature is normal and patient feels well. Falciparum may not exhibit classical paroxysm because it is severe disease, continuous fever, 24 hours periodicity. هذه تخص الملاريا البلازموديوم falciparum. Rupture of infected RBCs associated with antigens and toxin release. This leads to production of high tumor necrosis factor alpha, which is virogenic. This leads to produce fever. إذن سبب الفيبر هو production of tumor necrosis factor alpha. This table indicated the disease severity and the duration compared between the four species. طبعا هنا ما أريدكم تحفظون الأرقام، أريدكم تلاحظون على النقطتين الأخيرة من الجدول إنه الأنيميا more severe in falciparum and less severe in Plasmodium ovale. Complication, we see it in Plasmodium malaria lead to renal complication, while in Plasmodium falciparum lead to cerebral complication. We will start with the Plasmodium falciparum. Malignant tertian malaria produce serious disease with mortal consequence due. ليش السيفيريتي عالية بالفالسيبارم؟ due to the high parasitemia due to reproductive capacity of the parasites. طبعا هنا عندنا الشايزونت راح يكون لنا حوالي reach to 36 ميرازوت. إذن the capacity of reproduction here high. Second, sequestration الاختباء of Plasmodium falciparum نتيجة السايتو adherence. راح نشرحها بعدين هاي السايتو adherence شنو. The lack of preference of the erythrocytes infect all age of RBCs. This leads to a highly severe disease. The high parasitemia and sequestration result in other complications associated with falciparum malaria, the most notable being anemia and cerebral malaria. Low liver cycle 6 days and blood cycle 36 to 40 hours periodicity. أيضا هذه تزيد من severity of the falciparum disease. Sequestration, السبب السيكوستريشن إنه cytoadherence protein expressed on the trophozoite and schizont stage. This protein will export to the erythrocyte membrane. طبعا الإرثروسايت infected erythrocyte, causing the blood cells to stick to the walls of small blood vessels, endothelial cells of vital organs, especially brain, lungs, gut, heart and placenta. إذا السبب بالسيكوستريشن هو وجود السايتو ادهيرنس بروتين اللي يخلي الخلايا المصابة الار بي سيز المصابة تلتصق بجدران الأوعية الدموية خصوصا للفيتال organs. This leads to minimize the removal of infected erythrocytes by the spleen and increase the parasitemia rapidly, giving rise of hemorrhagic complications of malaria, blocking the venules by the attached to of mass of these infected red blood cells. راح تخلي الخلايا تلتصق واحدة بالأخرى المصابة وبغير المصابة تكون لنا clot like. This lead to cause hemorrhage. So this lead to symptoms such as placental and cerebral malaria. In cerebral malaria, the sequestration red blood cells can break the blood-brain barrier, possibly leading to coma. Cerebral malaria is associated with retinal whitening, which may be a useful clinical signs in distinguishing malaria from other causes of fever. Consequences of severe malaria, including coma and death if untreated. Young children and pregnant women are especially vulnerable. يعني الناس اللي يتأثرون أكثر بمضاعفات الملاريا واللي تؤدي إلى death هم children واللي pregnant women because the immune system here it is incomplete or defect. We have another complication of malaria in Plasmodium falciparum infection. We call it black water fever or hemoglobin uric fever. Repeated attack of malaria associated with inadequately treatment malaria with quinine. هذه المضاعفات أو complication تظهر عند العلاج بالكوينين and uncommon with other malaria drugs. The hemolysis is caused by erythrocytic autoantibodies derived from previous infection with the same Plasmodium falciparum strain. Treatment with quinine for the first time lead to massive destruction of infected and uninfected erythrocytes. This leads to a passage of dark red or black urine. Then the black urine or dark urine because of hemolysis of RBCs. The immunity against malaria is slow to develop, short-lived, non-sterilizing. Lead to low parasitemia and less symptoms only. Anti-parasite immunity prevent merozoite invasion. Eliminates infected erythrocytes. Anti-disease immunity lead to neutralization of exo-antigens or toxic effect. Immunity against malaria is strain-specific. A humoral and cellular immunity occurs with multiple exposure. Cerebral malaria occur in non-immune individuals, as we said before, in endemic areas. In the Plasmodium vivax and the Plasmodium ovale, infection relapse after a period of dormancy may result from periodic release of merozoites from liver because of hypnozoites. طبعا نراجع المحاضرة السابقة حتى نعرف أو نتذكر تعريف الhypnozoites. Owning the lack of an immune response to the intracellular parasites. Innate or non-acquired immunity to malaria is well demonstrated. African or African Americans lacking Duffy blood group antigen F, A and B are immune to Plasmodium vivax because this genetic factor appears to be necessary for successful merozoites penetration of the human erythrocytes by the Plasmodium species. راح نلاحظ إنه الإصابة بالملاريا كأنما الباراسايتس يدور على الخلايا الصحيحة غير المصابة، فأي ديفكت بالهيموغلوبين بالار بي سيز هنا راح يجعلها ممنعة ضد البلازموديوم انفكشن. فأول تمنيع هو lacking the Duffy blood group antigen F, A and B. Also we have sickle cell hemoglobin inhibits growth of Plasmodium falciparum. This genetic factor is widespread in area of Africa, hyperendemic for falciparum malaria. Other red cells abnormalities such as glucose 6-phosphate dehydrogenase deficiency appear to be protective of erythrocytes and thereby reduce the severity of plasmodial infection. Vaccination, we have three strategy of vaccination for malaria. طبعا إلى الآن ما عندنا أي فاكسين يخص أي parasites، لكن البحوث مستمرة. فالبحوث عندها three strategy are still being pursued. First, anti-sporozoid to prevent liver cells infection. Anti-merozoid to prevent red blood cells infection, and vaccination anti-gametocyte to block transmission. إذا هذه الثري استراتيجي دا يشتغلون عليها لإنتاج الفاكسين، أما يحدون من الليفر انفكشن أو يحدون من الار بي سيز انفكشن أو يحدون من انتقال الباراسايت between human and mosquito. The scientists who study malaria note that children exposed to repeated infections in hyperendemic areas develop a high degree immunity, although this immunity does not imply eradication of infection, but rather a balance between parasites and hosts. إذا الإميونيتي اللي تتكون ضد الملاريا ما راح تحد من النيو انفكشن، لكن تعطيني مناعة توازن بين الباراسايت، بمعنى آخر إنه تقلل الأعراض. The failure to induce protective antibody in vaccinated individuals lead research investigators to focus on the role of cell-mediated immunity. كنا نعرف إنه immunity against intracellular parasites, Protozoa, it is cell-mediated immunity, not humoral immunity. Malaria diagnosis. In endemic areas, symptoms such as fever, chills, headache, malaise, it's used by the physician, their physician familiar with these symptoms. Also, history of being in endemic areas, splenomegaly and anemia as a disease progresses, but it is not confirmed the diagnosis. We confirm the diagnosis by microscopic demonstration of parasites in blood smear. We have two types of blood smear, thick blood smear, it is more sensitive, and thin blood smear to identify the species. Repeated smears every 12 hours for 48 hours if negative. Also, we have antigen detection, we call it dipstick, are also now available. We have also serological tests such as EFAT, ELISA, and we have a nuclear test, PCR. Anti-Malaria Chemotherapy. طبعا هنا ما راح نجي ندرس drugs، راح ندرس strategy of treatment. We have many strategies for treatment. Causal prophylaxis, this strategy to prevent infection, to prevent liver stages. Suppressive prophylaxis to prevent clinical disease, blood stages. Treatment therapy or clinical cure relieve symptoms and eliminate blood stage parasites. Curative therapy or radical cure to eliminate parasites with or without symptoms. The final strategy, it is anti-relapse treatment to eliminate hypnozoids. This occur in species Plasmodium vivax and Plasmodium ovale. Mixed infection. إذا تذكرون بالليشمانيا قلنا هنا إنه ما عندي كروس immunity، لكن ما لاحظنا إنه شخص مصاب بالكوتينيوس ومصاب بالفيزرال leishmaniasis. But in malaria, in endemic areas, it is not uncommon to find mixed infection with two or more species of malaria in the same individual. Mixed infection لاحظوها with Plasmodium vivax and Plasmodium falciparum is the most common combination. The clinical picture may be atypical with bouts of fever occurring daily. Distribution of malaria parasites. Plasmodium vivax, most widespread found in most endemic areas including some temperate zone. احنا قلناها بالمحاضرة السابقة لأنه هو more tolerate the lower temperature. Plasmodium vivax primarily tropics and subtropics area. Plasmodium malariae, similar range as Plasmodium falciparum, but less common and patchy distribution. Plasmodium ovale occurs primarily in tropical West Africa. Malaria in Iraq. Malaria, it is found in Iraq from ancient time. The transmission season in Iraq starts late in April and continues till the end of November with 2 weeks of transmission, one in June and early July, the other the major in October and November. هذا يتبع لنشاط وتكاثر الموسكيتو وزيادة حاجتها إلى التغذية البلد ميل فيزداد انتشار المرض. In 1957, the malaria eradication project was officially started in collaboration with WHO and UNICEF. Almost we have Plasmodium vivax is the only or the most dominant species. In addition to Plasmodium falciparum is found in Iraq. Plasmodium malariae is found but not high rate. إذن الأعلى ريت السبيشيز الموجود بالعراق هو البلازموديوم vivax، حالات قليلة من الفالسيبارام والملاريا. Malaria control, we have also strategies, many strategies. First strategies reduce human mosquito contact by using impregnated bed nets, repellents, protective clothing, screens, house spraying, all these methods to prevent human mosquito contact. The second strategy for control measure, it is reduce vector by using environmental modification. غير environment حتى ما تنمو بها الموسكيتو. Larvicidal and insecticidal. Biological control by using sterile male or natural enemies against mosquito. The last strategy by reduce parasites reservoir. طبعا قلنا أن الهيومن هو نفسه reservoir host because anthropogenic disease by diagnosis and treatment. كل ما كان أسرع diagnosis والtreatment كل ما قللنا عدد الإصابات. Also by using chemoprophylaxis treatment. طبعا إلى هذه السلايد السابق خلصنا الكلام عن الملاريا. عندنا مرض آخر سببه باراسايت البابيزيا والديزيز هو البابيزيوسيس. It is a protozoan parasite of blood that causes hemolytic disease known as babesiosis. Infecting cattle, livestock, and domestic animals. إذن هو zoonosis مو مثل الملاريا. People who contract babesiosis suffer from malaria-like symptoms. إذن disease يشبه الملاريا يختلف عنه بداية إنه هو zoonosis not anthropogenic disease like malaria. طبعا أكو اختلافات أخرى راح ندرسها لاحقا. As a result, malaria is a common misdiagnosis for the disease. Babesia is a protozoan parasite of which Babesia microti and Babesia divergens are the two species to most frequently infect humans. إذن هذول التو species هم اللي more frequent يصيبون الهيومن. Common name for the disease include Texas cattle fever, red water fever, tick fever بالإضافة إلى البابيزيوسيس. The disease is asymptomatic or mild with flu-like symptoms. In cases of symptomatic infection, symptoms are characterized by irregular fevers, chills, headaches, general lethargy, pain, and malaise. In severe cases, hemolytic anemia, jaundice, shortness of breath, and hemoglobin urea are documented due to the lytic effect of parasitic multiplication. Immune competent individual with healthy spleen often recover without treatment. Spleen optimized patients are more susceptible to the contracting the disease, and the course of infection often ends fatally within 5 to 8 days of symptoms onset. Parasitemia level can reach up to 85% in patients without spleen compared to 1 to 10% in individuals with spleens and effective immune system. الترانسميشن طبعا النقل هنا يختلف عن الملاريا. Babesia is spread through the saliva of tick when it bites. إذا هناك تنتقل بالمسكيتو، هنا تنتقل بالتك اللي هو القراد بالعربي. At its initial stage a tick will bite into the skin for the blood milk. إذا النيفيال طبعا هاي اللاربال ستيج للتك، تنقل الديزيز في حالة اللاربال ستيج والادلت ستيج. هذا أيضا يختلف، هناك الموسكيتو only pregnant female mosquito، adult طبعا female. The most common vector is heart tick. طبعا هناك أنواع من التك، فالهارت تك هو اللي ينقل الديزيز commonly known as their tick is also the vector of other tick associated illness such as Lyme disease اللي هو bacterial infection. إذا التك ما ينقل لنا فقط الباراسايت، ينقل أيضا bacterial. هذا هو الهارتك، هاي بيكتشر للهارتك اللي ينقل لنا البابيزيا. Morphology. Babesia enter erythrocytes at the sporozoite stage. Within the red blood cells, the sporozoites become cyclical and develop into the trophozoite ring stage. إذا هنا البابيزيا أيضا from differentiate from malaria. Malaria enter liver and produce liver stages. Babesia مباشرة للRBCs الموجودة بالperipheral blood. The trophozoites morph into the merozoites, which have a tetrad structure conoid a Maltese cross form تشبه الصليب. This tetrad morphology is unique to Babesia and serve as distinguishing feature from Plasmodium falciparum. Trophozoite and merozoite growth ruptures the host erythrocytes, leading to release of vermiculus. These infectious parasites body rapid spread throughout the blood. These two pictures indicating the most distinguished stages. We have in the right ring stage. طبعا هنا بالرينج ستيج ما نقدر نميزه عن الملاريا، لكن بالتتراد مالتيز كروس اللي تشبه الصليب هذه مميز، هذا الستيج كلش مميز عن الملاريا. فبهذا الستيج الموجود بالار بي سيز ممكن نميز البابيزيا عن البلازموديوم. This picture indicating the life cycle of Babesia species. Mode of transmission by tick bite بالتحديد الهارت tick Exodidae species. Also we have blood transfusion can transmitted the infection. نلاحظ من الصورة إنه التك ما يأخذ الإصابة from human وينقلها إلى human آخر، يأخذ الإصابة من animals وبالتحديد هم الرودنت والدير. فبالرودنت هنا الانفكتيف ستيج هو سبوروزويت، وراح يتحول إلى ما عندنا ليفر ستيجز هنا قلنا راح يتحول داخل الار بي سيز بالبريفرال بلاد إلى تروفوزويت اللي هو رينج ستيج، then باي شايزوغوني يتحول إلى تتراد مالتيز ميروزويت، وتتكرر هذه يصير رابتشر بالار بي سيز وتتكرر هذه الارثروسايت سايكل. some of the merozoites ممكن تعطيني gametes. When the tick take blood meal from animals, will take macro and micro gametes, unite and produce in the gut of tick, produce zygote or akinete, which enter the salivary gland by sporogony, produce sporozoites. Sporozoites, it's also infective stage for human. In the blood of infected human, transfer or develop to the trophozoite ring stage, and by schizogony produce merozoites tetrad stages. This cycle will repeat. Diagnosis. Blood sample testing. It is important to pay specific attention to particular morphology of Babesia in blood smears because it is substantial, similar to malarial parasite, Plasmodium falciparum, results in many patients suffering from babesiosis being misdiagnosed with malaria. Also, we have indirect fluorescent antibody, EFA test, immunoplot test, and PCR. A treatment, in many cases, patients spontaneously recover having only experienced mild symptoms undiagnosed as the disease. The standard treatment for symptomatic individuals was oral or intravenous clindamycin with oral quinine. Oral atovaquone with oral azithromycin. Control measure of babesiosis by control vector ticks. Also, splenoectomized individuals are very susceptible to babesiosis and have a significantly higher fertility rate. Hence, such persons should take special precautions against exposure. This table differentiates between malaria and babesiosis. طبعا احنا ذكرناها ويجوز اكو اشياء ذكرناها ما مذكورة بهذا التيبل ممكن انت اضيفها الى هذا التيبل. By this slide we reach to the end of our lecture. Thank you for your listening.